So CELMoDs are going to be a very interesting and exciting class of drugs to work out how to use. The early data from Iberdomide and Mezigdomide trials shows that they do have the potential to overcome IMiD resistance in a reasonable proportion of patients. And it will take a lot more work to work out how and why that's happening and which people it does happen in and which people it doesn't happen in. And it brings us into the really quite complicated landscape of IMiD resistance, because that involves genetic changes in the tumor, it involves phenotypic changes in the tumor, but also the immune microenvironment and the state of the T cells, whether they can be affected by the CELMoD or the IMiD still, which really is potentially quite a big effect as well. So I think there's a lot of work still to be done, but the bottom line is that these are a class of drugs that will still work in patients who were resistant to Pomalidomide and Lenalidomide before. So that will be very exciting to work out and to see what we can combine them with. Can they be used to enhance the activity, for example, of immunotherapies like T-cell engagers? It'll be great to watch that data come through in the next few years.